Good evening and welcome to all. This is Ankana, the assigned moderator from IJCP Group. I wholeheartedly welcome all the delegates across the country. We are fortunate enough to get supported by the doctors. Thank you all the doctors for taking out time to join us today. Now I am taking this opportunity to welcome today's Master Doctor, none other than the keynote speaker, Dr. Suresh K. Sir. Sir is MD, DIH, DF, FIAP, FIPHA, FISCT. He is the family physician, public health consultant, Bangalore, and visiting professor of practice, KSRDRU, Garat, Karnataka. Now, with the help of Sir and his wonderful insights, we will be taking a close look on today's topic. As the monsoon season brings much needed rain, it also increases the risk of food poisoning due to contamination and improper food handling. Join us for an informative webinar on food poisoning in monsoon, the integrated management and prevention. This session will cover essential strategies for managing and preventive foodborne illness during the rainy season. Without any further delay, sir, I would like to hand over the session to you. Kindly proceed with your topic.
Thank you, Ankana. Welcome, doctor friends. After a peak summer, we are entering into monsoons. As we know, many districts are having heavy rains. Of course, the arrival of monsoon season is always welcomed by Indians, particularly after such a hectic heat wave season. It signifies a respite from the sweltering heat and unbearable humidity. However, from the health point of view, the season of the rains comes with its own set of drawbacks. The monsoon season brings, as you know, significant rainfall and higher humidity level, creating a perfect conditions for mosquito breeding, which results into many vector-borne illnesses. We'll come to that. Apart from this, the common conditions of catching cold, fever, exacerbation of asthma, diarrhea, the most challenging practice which becomes hazardous for the health is maintaining hygiene in kitchen and food. Food making, food handling, food serving, food eating. The common list of 8 to 10 conditions which take upper hand in this season starts from common cold and fever, viral influenza, malaria, typhoid, hepatitis A, leptospirosis, particularly in the urban areas like Mumbai and all, diarrhea, chikungunya, some skin problems, and most importantly, food poisoning, which is the subject of discussions today. Let me start with a case which I came across just yesterday and take you through some of the situation in the country today. Why we as general practitioners should be alert and be able to do diagnosis, most importantly based only on clinical manifestations, because in most places diagnostic laboratory tests may not be available. I start with the case of Vandana, one of my apartment colleagues, a 56 years old lady, came last Thursday to me around in the evening saying that her tummy, which was upset yesterday, continues to be aching and there is gaseous distension, though loose motions have come down, but discomfort was continued for the second day. A detailed history reveals that she and her daughter-in-law had consumed pasta which they had brought it from a street vendor. Now there is a message here. One is getting some food which is not prepared from a place where the hygiene is always a question mark. The second important point which comes here is, though both the young lady, that is the daughter-in-law, and this lady ate it. Both of them had mild discomfort on day one. Later, about 6 to 8 hours afterwards, while the young lady managed to not suffer further, this lady had diarrhea. Of course, there was only one vomiting. What does it give? The message gives is that even if you eat the same food, not all individual respond similarly. It all depends upon the host resistance and our intestinal microbiome. So on physical examination, except for a little tender in left iliac fossa, as you can imagine, it is already more than 24 hours, the fecal content would have more towards larger colon and further down. And there was a bit tender in the upper third of the abdomen, again the transverse colon level, and gaseous distension on percussion was definitely there. Now, this is the situation where people can take advantage of giving any number of drugs. Ideally, no antibiotics are required. What I did was, since the symptoms are not much, there is not much of dehydration, considering it to be just mild food poisoning, what I asked to do was to take what we call as probiotics. Basically, it is the curd. One can officially prescribe the markedly available probiotics. Every 3 hours, a cup of it. And to get back to me next morning if the problem continues. I meet her very next day in the morning, walking around 6:30. She was fine. The message here I want to give is most of these food poisoning cases are mild. They reach the general practitioner only after trying some home known remedies. Nobody comes directly to you unless it is a severe vomiting or diarrhea. Therefore, if you want to make money, you can prescribe certain professional or commercial probiotics, any other treatment, but antibiotics are clear no. And all of us know the recent media coverage of Janhavi Kapoor. Why did I quote this example? This is only to say that food poisoning does not differentiate between rich or poor. Just because you come from high socioeconomic situation, it does not mean your food handling hygiene or food preparing hygiene could be perfect. That means anybody can get affected. Now, what are the cases that prompt this season? I will give you some three media case stories. Basically, one of them is in Belgaum district of Karnataka on 22nd May this year, where 46 people fell sick of diarrhea and vomiting following consumption of a suspected food poisoning food. This is from a village known as Hulikatti, where people had consumed prasadam from a local festival or a fair of Bireshwara and Karyamma temples. They all complained of stomach pain, vomiting, and some sort of a dysentery or diarrhea. At least 8 of them needed hospital administration in Dharwad District Hospital. Of course, all of them recovered in 24 hours. There is one situation which is common in this season. Any fairs and festivals, the prasadam is consumed as if It is made of perfect hygiene, but unfortunately, many a times this happens. The second I quote is of IPL match on 12th May this year, where a cricket enthusiastic, while seeing case, ate something from the local cafeteria. Of course, some of his friends also ate, but this guy experienced stomach pain, collapsed while sitting only while watching the match. Of course, he was given primary treatment and an ambulance which are there just outside the stadium. And later it was confirmed after taking the food sample of the canteen, and of course the course of penalization all continued. So the message here is any group of people sitting eating food, some will get, some may not get, but there will be a common history of consuming certain common item. A week earlier, that is on the 5th May of this year, in Channapatna town of Ramanagara, also there were 150 people after just consuming ice cream at a wedding after the lunch. So all these are examples of community level outbreaks of food poisoning in this season. If you look at the official documents, the country generates weekly reports for outbreaks. The latest report available is of 21st week, which stands for 23rd to 26th of May. There were 13 outbreaks across the country reported in 1 week. It is outbreaks, not number of cases. In each case, the number of cases are differing from 10 to 200. Some cases of recent after this 21st week, these are the media reports. Just 27th of July, 2 days ago, 1,000 children in a school ate their school lunch. Of that, 130 had to be hospitalized after complaining of vomiting and diarrhea. Of course, all of them are managed well. No fatality is reported. Similarly, in an apartment complex in Kerala, on 5th June, and in the previous few days, there are over 300 people, residents of that complex, who complained of food poisoning symptoms were treated. And another case where 10 Bangalore University hostel students fall sick on June 3rd. So all again, these are indicating that food poisoning is so common, be in an advanced state of Kerala or Bangalore, or less developed states of Bihar. These are very common. The next list of few outbreaks in the previous few weeks here I want to draw your attention only towards the states like Maharashtra, Kerala, which are supposed to be well advanced, highly hygienic people and all that, compared to Odisha, Madhya Pradesh, Bihar. Generally, we suspect that the cleanliness there is poor. But when it comes to food poisoning outbreaks, there is not much of difference. Basically, it indicates the human behavior. Though we may look clean, we may dress excellently, our kitchen hygiene, food handling is far from required level. This is just a map of showing the 21st week, that is the 20th to 26th week. This, if you look at slowly, the 13 outbreaks of food poisoning, one here, one there. So you can see these, which indicate that across the country, irrespective of socioeconomic status, food poisoning in this season is a common problem. Now, having known the situation today, most of the general practitioners may not be worried about these outbreaks. What you need to do is know about the cases which may come in small numbers individually to you. So we start with understanding the definition. Basically, when we say food poisoning, we say an illness which comes after consuming some contaminated food or water, both. Here, the root cause is harmful bacteria or certain toxin produced by these bacteria, which survive in food or beverages. Food poisoning in general is not a serious condition. Generally may get better within a few days with or even without treatment. Exercising precaution is called for. The common symptoms of a person coming to you is upset stomach, vomiting, nausea, diarrhea, cramps or pain in the abdomen, sometimes blood in the stool, fever may be there, may not be there, and headache. The national practice observations and according to the Food Safety and Standards Authority of India, FSSAI, food poisoning from E. coli, Salmonella, and other contaminants are very common during rainy season. This visual gives you the common causes of food poisoning: bad or expired food, eating raw food, particularly raw meat, fish, etc., consumption of alcohol contaminated, unwashed hands and utensils, which is common among the street vendors. They may be very tasty food. In cities, particularly in Bangalore and major cities, if you go after 10 in the night, you see hundreds of them selling fresh item. But you never know. Sometimes they are cold, prepared in the afternoon, warmed and given. Or it could be dirty water if you consume from them, and improper storage of food, either in the selling or whatever was prepared in the afternoon. Now, if one or two cases come to you, what is the procedure you are doing? In the primary case setup or in the general family physician's cases, basically you depend on a detailed history. Number one, details of food consumed, particularly the previous 24 to 72 hours. Physical examination may not give except the dehydration status, and differential diagnosis to differentiate other reasons for vomiting, diarrhea, or other symptoms. So therefore, as a general practitioner, what we must do? Most important principle is hear the patient's complaint and ask some details which they may not think important. Generally, it happens. For example, in my case, she did not tell about eating pasta until I asked specifically. So basically, they may not even correlate that something which they ate in the last 72 hours might harm them. Therefore, go item by item, starting from immediate up to last 3 days. Then you have to look at symptoms not only in the patient coming to you, but anybody, either his relatives, friends, who ate the same item with the person. There may be some mild symptoms, they may not be as severe as this person. Then you may also look for changes in the drugs the patient is taking. Most importantly, recent travel. If they have traveled recently and ate something on the train or bus or flight, they may not associate. So, therefore, recent travel becomes important. The most important or the challenging situation for the practitioner is if only one person or only one family gets food poisoning, it may be difficult to pinpoint to the food which was consumed. Nonetheless, most often you will be able to track what caused this. What is more important is the time of eating the contaminated food and the first signs and symptoms. All these organisms, usually we categorize them broadly for clinical purposes into two categories. One is which start affecting, that means there is already toxins were there in the food. As soon as they enter the tummy, they start bothering you. So the toxins, ready-made toxin, immediately act, and most often they irritate the upper tract, therefore you see a lot of vomiting. If it is only the bacteria or other organism, they take time to develop within the body. Symptoms may start as late as 24 hours later and continue for long. We'll come to that individual examples later. So, therefore, associating eating of a food contaminated and a time of sickness, either in our days, usually helps in corroborating the symptom and suspecting the type of infection. So, if you particularly corroborate what they ate during the last few hours to few days, as I told you, one would be able to clinically suspect and see how do you manage it. Physical examination, as I told you, give you only the signs of dehydration, tenderness, and interest, if any. Sometimes the hepatitis initial signs may be an indication. In general practice, very rarely laboratory tests are required, but if you person wants to be specific, stool samples or vomitus sample can be sent for culture, but rarely required. What public health people do is in such big outbreaks like festivals, fairs, marriages, etc., they send a sample of both food and the vomiters and stool of the patient to confirm the type of organism that affected. Signs and symptoms, simple, typical, more attention toward the vomiting, can't hold while even they are sitting, a tummy on the hand, indication of discomfort in the tummy, the facial anxiety and thing you can see. So how do you manage an individual case? In India, by the time you see a case, most cases would have improved within the first 48 hours with some home remedies. What do people do before coming to you? Because this is important to seek if they come to you also later. Most people stop consuming food. We call it Langanam Paramaushadam. So whenever the elderly people tell, if you are having loose motion or vomiting, stop eating everything. till you feel comfortable. Once their stomach is settled, they will start eating light food, what they call as light, freshly prepared food, non spicy, when they feel hungry. They may be replacing body fluid by consuming a lot of water, coffee, tea, buttermilk, sports drinks, juices. Some may even consume over the counter rehydration fluids like Pedialyte, Enphalite, etc. etc. Most of them would avoid food like dairy products, alcohol, nicotine, fatty or highly seasoned foods. Rest and rehydration is generally there at a bed rest. Sometimes they may get an over-the-counter anti-emetics and anti-diabetic drugs, anti-diarrheal drugs. Anti-diabetics are sometimes sold by the pharmacists. They themselves will give the tablet. Antidiarrheals are usually antibiotics or binding solutions. Now, when the case comes to you at a clinic, how do you proceed? Take the history of what they have already done. The history, as I told you, would give you to suspect possible type of infection, whether it is enteritis or lower end infection. And the basic management includes fluid replacement. The cases are mild, they can be managed only on oral fluids. But if the profession demands, if the patient expects you to give an IV fluid, there is no harm in giving IV fluids for rehydration. The common electrolytes missing usually are sodium, potassium, and calcium. So you must pick up fluids which contain these. And IV fluids must be given under strict observation. Sometimes they may get reaction. So therefore, be prepared for an unexpected reactions to handle them. As I told you, most cases can be managed on oral rehydration, but unfortunately, oral treatment may not fetch you money. So therefore, if you want to do some extra, draw attention, IV fluids you may give 1 or 2 pints. Antibiotics generally are not advocated for food poisoning, but if you suspect a bacterial infection and the vomiting is severe, you can try antiemetic injections and either IM oral or IV depending upon the urgency. Antibiotics, if given, are only to minimize the risk of complication. Commonly used drug is doxycycline. You can use any other alternatives which you are used to. Sometimes parasitic infection like giardiasis, amoebiasis may get complicated with bacterial infections or even viral, leading to food poisoning situation. In that case, combination of antiparasitics like flagyl, furosolidine, etc. can be given. Use of probiotics has become common for all diarrheal cases. I can remember my first practice in 1970 when a young child of my own relative was brought after travel from North India for nearly 48 hours on the train, was flooded with antibiotic, antiemetic, antiparasitic, and child continued to have diarrhea. I stopped all of them, gave a cup of buttermilk for every 3 hours. Believe me, in next 24 hours, child was normal. So probiotics, now you have the commercial products also, depending upon the purse of the patient, either advocate buttermilk curds or commercial probiotics. Let's get into some technical understanding just for the backup of your technical knowledge. In terms of practicing, I think we have covered most areas already. So, what are the key characteristics you should know about the food poisoning? There is usually a history of ingestion of a common food by more than one person. That more than one person can be 2, 4, 20, 200,000. The attack is among the many persons at the same time where the common food was shared. Of course, there are no clinical types. That means the same food may give different type of symptoms among different people depending upon the host resistance and their enteric microbiota. Bacterial type of food poisoning is caused by ingestion of contaminated food, either living bacteria or the toxin, sometimes even both of them. Non-bacterial food poisoning is very uncommon, but it may happen in some areas due to arsenic, cadmium, mercury, and certain plant and seafood, fertilizers, pesticides, etc. The commonest bacterial poisoning in India are Salmonella, Staphylococcus food poisoning, Clostridia pharyngeis, botulism, and Bacillus cereus. We'll go to each one of them shortly. We have already discussed the common symptoms in Salmonella, which is the first most common condition in India. Usually there is diarrhea. Vomiting is less in Salmonella because it takes some time. There is stomach cramps or pain, fever may be there, nausea and vomiting, sometimes both. Headache is also there. Now here, in the recent years, Salmonella infection has increased a lot because the occasions of communal feedings have increased. People get together, enjoy food a lot. So any small contamination can lead to these outbreaks. And an increase in the international trade of human food. So in the transition, things may happen, go wrong anyway. It is also a fact that salmonellosis has increased in the farm animals in the recent years. And the wide distribution of prepared food in schools, marriages, fairs, and festivals. These are the key reasons why we see salmonella food poisoning more common. The commonest organism here are Salmonella typhimurium, Salmonella cholera, suis, and Salmonella enteritis. The source of this infection is usually man gets infected from eating farm animal or poultry through contaminated meat, milk or milk products, sausages, custards, eggs and egg products, but most importantly, rat and mice who are infected, their urine is infected, they contaminate the human food if they are there in the kitchen. The outbreak usually manifests only after 12 hours, and the pathophysiology is the organisms develop in the intestine. Therefore, you get a longer time. Not there are no toxins already outside the body before it enters. Therefore, it takes some time, and the results into what is called as acute enteritis or colitis. Therefore, you see a little later manifestation, more of diarrhea, less of vomiting. And because of this infection, the onset is sudden. There will be chills and fever, nausea or vomiting or both. profuse watery diarrhea when it occurs. Though the condition is self limiting, the chronic status may continue for weeks. The fatality is less than 1% in India. We do not see much of deaths. The other alternative is staphylococcal food poisoning. It is also common. The organism is known as Staphylococcus aureus. It's a gram positive anaerobic coccal bacteria, appears in clusters and produces toxin. That's important. So this is already ready to bother the moment it enters. Currently, we know at least 5 different types of enterotoxin these organisms produce. The toxins are usually found when these contaminated food are kept in between 35 and 37 degrees, that is the normal room temperature, and they are relatively heat stable. They can resist boiling up to 30 minutes, and nobody cooks any food for more than 30 minutes. These bacteria are ubiquitous, means they are available in nature everywhere, found on human skin, nose, throat, boils, poison infection in man and animals. Cows and buffaloes, particularly those who have mastitis, are supposed to be most responsible for the infection transmitting through milk and milk products. Here, unlike the salmonella, the infection is to incubation is very short. That means within the first 3 to 4 hours, as early as 1 hour, because there is toxicity which is already preformed, ready-made dose is given. So the mechanism here is the preformed toxins which are in the intradietic, that we call this, within the food we eat, they are already there. In the food they remain, both toxins and organism, not destroyed by heating as I told you. Therefore they directly enter the intestine. Some of them may also reach central nervous system. The common complaint here is onset of vomiting is first, within the first 3 to 4 hours, and abdominal cramps. Little later there could be diarrhea. If some cases they are severe and there could be blood and mucus also, mainly because of the toxic infection. There is very rarely any fever because it is not bacteria which are multiplying, it is a ready-made toxin which is affecting, resulting in the problem. Of course, here also deaths are very rare. Diagnosis goes by again clinical thing. If something starts as early as 2 to 4 hours in the initial of consuming certain food, management disposes the standard rehydration, antiemetics to stop, and an antibiotic if suspected bacterial infection. Stool culture can prove the causing bacteria, but usually not required. Clostridia perfringens, food poisoning is another thing. Here, the usual story is some food which was stored and cooked 24 or even more hours before, consumed to after allowing it to cool to room temperature, and then heated just before eating. When you heat it before eating, you don't boil it, it doesn't reach a temperature where existing organism, if any, can die. So it is a less common type of food poisoning, but therefore the recovery is also rapid and no deaths at all. These organisms are anaerobic. They form spores resistant when deposited on the food. They survive the normal cooking up to 100 degree, germinate when the temperature is low between 12 to 60, and proliferate rapidly between 30 and 50 degrees centigrade. Once ingested, Several toxins are already there in the intestine. Most of the outbreaks in India have been associated with ingestion of meat, dishes, and poultry cooked much earlier, cooled, and then served just to make it warm before serving. Symptoms are there within 16 to 24 hours. Incubation period is a little longer here, unlike the staphylococcus. Usually the peak incidence occurs between 10 to 14 hours after that. So the timing, as I was telling time and again, is very important to listen to these stories. As the spores survive cooking, cooked meat, then when the temperature is conducive between 30 and 50, when you usually warm up, they produce toxins known as alpha and theta. The common symptoms of diarrhea, cramps, no fever or very mild fever, usually around 24 hours after the consumption. Nausea and vomiting is rare, only diarrheal symptoms. The condition lasts only for a short duration because this is a ready-made toxin. Whatever damage the available toxin can make, it will make, and then it is over. So the recovery is rapid. There's hardly any deaths. The another organism is Bacillus cereus. Of late, it is becoming more frequently in recent years. It produces two types of enterotoxins. One is known as the emetic form, that means which encourages vomiting. Another is diarrheal form, which results in diarrhea. Diagnosis is basically clinical, but if you want a confirmation, isolation of the organism from the food, vomitus, or stool, but rarely required. It is a anaerobic organism, spore bearing, as we already told. Once they are spore bearing, they can sustain normal cooking, and therefore they germinate when there is a appropriate favorable temperature. The worst condition of food poisoning is botulism. I would say that moment you suspect botulism, please don't handle any such cases. Because botulism is a serious type and it affects nervous system, and here the signs and symptoms are mostly related to nervous, like dysphagia, difficult to talk, difficult to swallow, diplopia, vision problem, ptosis, dysarthria, blurring of the vision, muscle weakening, and even quadriplegia. So if you see such cases, please do not venture in handling those. There are, because case fatality as high as 50 to 60%. Usually death occurs because of the respiratory or cardiac failure over a period of 4 to 8 days. Do some primary intervention and refer the case to hospitals. Even there, reviving the case is not going to be easy. Therefore, I have written boldly, these primary care providers must not try to manage these cases. The technical issues relating to this, the botulism toxin is a neurotoxin protein produced by the organism known as Clostridium botulinum. It is classified into eight neurotoxin, A to H, and they are antigenetically and serologically distinct, but structurally they look alike. Unless you do an antigenic test or serological test, you will not be able to know what is it. Fortunately, only 3 out of these 8 types, A, B, and E, cause toxicity in the human beings. The remaining cause in the animals. These bacteria are distributed in soil, dust, intestinal tract of the animals, and enter the food as spores. The food responsible are usually canned vegetables, smoked or pickled fish, homemade cheese coming from the infected animals, and other low acid foods. Incubation is much longer, between 12 to 26 hours, because these are also anaerobic conditions. Toxins will be performed into the food well in advance. The very indication of nervous systems as repeat dysphagia, diplopia, ptosis, weakness of limb, etc., etc., should alert you not to get into the management of such cases. As public health people, since I'm also a public health expert, only my learnings are not only from individual cases, having managed hundreds of these outside, the investigation of food poisoning reported from anywhere, be it a school or a college or a village or a tanda, what we need to do is secure a complete list of people involved, which is called as line listing, and their history of consumption of food basically. Laboratory investigation usually suspected food and vomitus and stool of the samples are sent to public health laboratories. Sometimes blood samples are sent for antibody detection. The environment is studied to look at possible pollution occurring, whether it is water, food, meat, vegetables, fruits, whatever it is. Sometimes there are animal experiments done. Most important analysis is what we call as epidemiological analysis according to the descriptive epidemiology, which is known as time, place, and person distribution, to narrow down, to identify the item which might have caused the outbreak. A case control study may also be undertaken for understanding if there is a causal association or it is just a coincidence. Being a public health person, I cannot end this session without talking of prevention. There are nearly about 10 steps of prevention where though the doctor has little role, but as an individual we have a role and also have a role of educating communities, that is families. Since we are all known as family physicians, we are responsible for the families who come to us regularly for every little disturbance in their health. So, in this, prioritizing the food hygiene is basically an individual or a family practice. Come rainy season, one has to be doubly careful. Maintaining hygiene in the kitchen as well as where the food is cooked. Keeping the kitchen surfaces, chopping boards, utensils, etc. clean and tidy to minimize cross contamination. Using separate cutting boards for vegetables and raw meat. Do not mix them up because cross contamination is very common. It is always best to use fresh ingredients. So if you are picking up anything, get fresh fruits, fresh vegetables, fresh meat. Refrain from purchasing pre-cut fruits or vegetables from the street vendors because their personal hygiene is a question mark. Similarly, while buying meat, fish, and poultry, see that you buy from fresh, well kept, or kept in the right temperatures. More importantly, buying packaged food, always check for expiry date, breach in packaging, and the storage, signs of spoilage, if any. Families and individuals must be told to cook their ingredients well always, particularly when you are using non-vegetarian meat, etc. One has to be doubly careful because most vegetarian foods generally get bacteria get killed, so we don't worry. But if it is not fully cooked, what is that fully cooked? We say maintaining at least 74 degrees centigrade. If you just warm up and remove, it may not help. One can use either a thermometer or common way we see in India is see that the boiling starts at least for a few minutes. Boiling anything for 2 to 5 minutes ensures that the organisms are no. But if they are spores, as I told you, it may not guarantee. Storing the food properly, another again, refrigerate all perishable food items. Don't not to leave the cooked food outside in the room temperature in this season. Set your refrigerator at the right temperature to prevent bacterial growth. Keeping oneself hydrated, consuming safe drinking water is one most preventive action individuals must do for their own. Drinking filtered water or boiled water. Never use ice cube from unreliable sources, even in summer. Avoid buying beverages from street vendors as their water quality may be questionable. The best in this season is to say no to street food. Unfortunately, when there is rain, most of our tempted for street food, whether it is pakoda, bhajis, etc. But pakodas and bhajis are not wrong as long as you eat freshly fried food. But if they cool for a while, then comes the danger. So be careful. Dairy products are a big concern because they get spoiled in the monsoon very soon. So milk and milk-based items better are pasteurized, are stored in a right temperature. Anything which is left in the room temperature for long, it is better to avoid and do not consume. If you are buying it market, check for expiry date and proper sealing while buying dairy items like paneer, etc. Fruits and vegetables, get as fresh as possible. Wash them in running water before consumption, just before consumption. Don't wash and keep it for hours and then eat. Some people wash it as soon as they get and they consume over the next 2 to 3 days. That's wrong. Every time you use, wash it in running water because some of them carry harmful pesticides, some may carry monsoon in during this season bacteria also. Leafy vegetables should be soaked in a solution of vinegar water or potassium permanganate. Peeling fruits can also curb the risk of ingesting toxic substances of the skin. Better be updated from the FSSAI. There are regular bulletins about the safety alerts, what to consume, what not to consume, what batch of particular meat or imported canned foods are wrong. Handling our food safety ourselves. Serve the food with clean utensils, plates. Do not use the same utensils for raw and cooked items. When in doubt about the safety of the food you are eating, better to discard than taking risk even if there is a little doubt. So these are the WHO's 10 golden rules, which is a repetition of what we have already heard individually. I will move on to the next. And thank you all. I'm sure each one of you can manage most of these food poisoning cases and also empower the community in the sense the families who are loyal to you. And your case management should basically be on fluid replacement, probiotics, antibiotics, anti-parasitic in that order of priority. Thank you very much. Questions, if any, are welcome.
Thank you so much, sir, for this comprehensive talk, and the PPT was so much informative. Sir, am I audible to you?
Very much.
Okay.
Loud and clear.
So, okay. So we are moving to the first question for today's session. That is, what type of antibiotics and PPI safe in pregnancy in gastrointestinal cases?
Basically, if it's a pregnant lady, we would try to avoid using any antibiotic, particularly in the first quarter, that means the first 3 months, because any of the antibiotics like doxycycline or any form of tetracycline are going to harm the fetus. Therefore, it is better to manage with rehydration, and only when it is unavoidable, some sort of ampicillin can be tried. But I would
Okay.
say it should not be required for more than 1% of the cases.
Okay. We are moving to the next question. That is, what are the common symptoms of food poisoning and how do they typically present in patients during the monsoon?
As I was telling, the food poisoning, in general practice, we are not worried about what is the organism causing. Based on the symptoms, we can generally pinpoint the type of organisms. As I told you, if the food was kept outside, and there are certain organisms which we discussed secrete toxin when the food itself. That means the food we eat is ready with toxin which cause symptoms within the first few hours. Maybe 1 hour, I have seen a case as early as within half an hour vomiting to a maximum of 6 hours. Here we call these are emetics. Therefore, what we need to do is control the vomiting there by either antiemetic, injectable, or oral. But there are bacteria which have to enter the system and multiply. They take a longer time of anywhere between 12 hours to 72 hours. In those cases, the signs are mostly diarrhea more than vomiting. So, therefore, three basic principles I repeat: control vomiting if it is there with injectable antiemetics. If it is not severe, even oral antiemetics can do. Second, look for dehydration. Most dehydration can be corrected oral rehydration. But if you think the person is really bad or you want to make a little more money, since I'm talking to a doctor, I'm saying personally, you can start an IV drip of 2 pins initially, then switch over to oral fluids. Antibiotics by and large are not required. And if the diarrhea happens to be one of parasitic, that is either giardiasis or amoebiasis superimposed by bacterial infection, then one may have to give antiparasitic. Basically, it is flagyl.
Okay. Moving to the next question. That is, what are the immediate steps to be taken when a patient presents with suspected food poisoning during monsoon?
Now, as an individual case, basically, I told history taking becomes important to associate the food which he or she ate in the last few hours and what type of signs and symptom it is creating. Because more than the actual symptoms, the interval between the food consumption and manifestation of symptoms gives an indication of type of infection. So history taking becomes more important for personal satisfaction. Physical examination have to be done. It is more for patients' consolation because that is not going to give the doctor much except for dehydration if there is any. But starting rehydration, depending upon the severity, as I told, should, and finding out if anybody else who has partaken the same food has similar symptoms. And all of them may not have severe symptoms. Some of them may be very mild. As I told you in my case report, mother-in-law had bad problem. The daughter-in-law who is young, hardly around 28, 30 years, she did not have anything except for an initial little upset. So therefore, it is more clinical management than any investigative requirement.
Okay. The next question is, how do you manage dehydration and electrolyte imbalances in patients with severe food poisoning?
If it is severe, where you think dehydration, as you know, can be diagnosed by simple test, apart from looking at tongue, eyes, etc., skin pinch, particularly in the children, it is more riskier, or elderly people, both of them, skin pinch will give you the severity. Once you diagnose it severely, start a quickly IV drip. Generally, we start with normal saline. You don't need glucose there. But if you do need, if the patient was not able to take feed few, let's say for more than 6 to 12 hours, giving glucose also gives some energy. But normal saline is the preferred. After a few bottles, after a few bottles of sun, one need to give some potassium supplements also.
Okay. Thank you, sir, for answering all the queries of our doctors, and thank you for your expert opinion that you have shared. And I'd also like to thank all the participating doctors to join us today. Okay, for your continuous participation. Thank you once again, sir, for your valuable insight and for your time and for being with us at the platform and sharing such valuable insights with us. So, with
And
all your permission, can we end the live here?
I just like to thank all the participants who are hearing me and you for giving this opportunity. You and IJCP in general. Thanks, Ankana. I go
Thank you.
off
Thank you so
to
much,
go
sir.
off.
Thank you.